Hello, everyone. My name is Jamie Beachy, and I will be your moderator today. On behalf of the Child Welfare League of Canada and the Canadian Association of Social Workers, I'd like to welcome you all to today's panel discussion on vicarious trauma, wellness, and resilience in the field of child welfare. This event will also kick off the Child Welfare League's new project called the Young Professionals Network. The network will provide online support, resources, and future events for professionals in the field of child welfare. Our panel today has a wide range of expertise in the areas of vicarious trauma, holistic wellness, and best practices for individuals and agencies. If you haven't yet read the panelist profiles, I would invite you to click on the speaker bio widget at the bottom of your screen to learn more about Steve Jeffrion, Sharp Doppler, and Denise Brend. I'll begin today's session with a land acknowledgement. The Child Welfare League of Canada is situated in what is known today as Ottawa, which is located on the unceded territory of the Algonquin people, who have been caring for the land and its people since time immemorial. The territory is now home to many diverse First Nations, Inuit, and Métis people. While we are all joining this event virtually, it's important for each of us to reflect and confront our own place on the land that we are situated on, its history, and how we can contribute to decolonization. I'll put a link in the chat once the discussion begins so that each of you can discover more about the land that you are situated on. So today, our webinar presentation will be approximately 35 minutes, followed by a 20-minute question and answer period that I will moderate. Please note that all the details you need, like how to access the presenter resources, get your certificate of attendance, and other housekeeping information, is under the announcement widget. All of the widgets can be accessed by clicking the blue and white icons at the bottom of your window. You can also resize and move around any of the elements you see on your screen to customize your viewing experience. Please note that the platform will generate your certificate of attendance after you view the required viewing minutes and after the presentation has concluded. It will be emailed to you, or you can log back on an hour after the presentation ends to download it directly. During the presentation, I encourage you to type in your questions for the presenters in the Q&A box at any time, and I'll begin asking them at the end of the presentation. Please note that only the presentation team can see your questions in the Q&A box. They're not public. If you want to provide a public comment, you can use the chat for general questions, and please feel free to put a note in there to tell us where you're joining from. I will now begin our panel discussion. So the first question for our panelists is, what is the importance of worker well-being in child welfare?
Who wants to start?
I'll start. Ani Bojo. I'm living and working in unceded Anishinaabe in Ottawa. There's nothing more important than worker well-being, because if workers are not well, if they can't care for themselves and have balance in their lives, in their mind, their body, and their spirit, they can't do the work well. It's like being a carpenter. If you're a carpenter, you need to keep your woodworking tools sharp, and you need to keep them oiled so that they don't get rusty. And if you don't, you're going to cause an injury, usually to yourself. You're going to mess up the piece you're working on, or any of those things. And when it comes to child welfare work, the workers are the tools, the instrument. And we have just as much a responsibility to care for that instrument. And the unfortunate thing is that there's all kinds of talk about how important it is, but there's not a lot of action. There's not a lot of action at all. And there's not a lot of support from agencies. And I get that that's because of funding and crunching and how much need there is and all of those other things. But it is, in my mind anyway, and having done the work in community, supporting community, I know how important it is. It is crucial. And if we don't start paying attention to it, we're going to see the same sort of thing happening in child welfare that's currently happening in healthcare. People are going to get burnt out. They're going to stop coming into the profession. Then what happens? Then we're left with people who are unwell, out of balance, and the potential for harm goes up and up and up. Miigwech.
Oh, Denise, I think your mic is off.
It's gotta happen every time. Thank you, Sharp. I so appreciate what you had to say just there, and it's a perfect start for today's discussion. I think one of the other aspects I wanted to put light on is that the instrument of change, what changes and improves situations for vulnerable children and families and strong children and families, is the helping relationship. And our relationships. And we see that more and more as research progresses into social science and relationships, the importance of security, predictability, of all different aspects of that relationship being present to enable the capacity for change. And I often think about how much goes into professional athletes being well and ready to get out on the court and play, and how little goes into making sure that our workforce is well and ready to face up to human tragedies that are often part of this work. The existence of pain and trauma and hardship is a toxin that all helping professionals in child welfare are exposed to. And it's just simply time that we manage that toxin. Thank you.
So what could I add more than that? I guess you say it all, but do you hear me guys well? Because I think there's a lot of feedback going on. Is it okay now? Yeah? Okay. Well, I would like just to add two things. I think that when it comes to helping others, we have to keep in mind the images of, an airplane crash. If you want to help others, you have to put your oxygen mask before putting it to others. This is the basic of helping others. How can you help another one if you're not well in yourself and you're not healthy? It's really difficult. And what I would like to add is that a lot of studies have been done on that subject, and a lot of meta-analysis that has been going on in the past years just that was the question about when do we want to help someone, when we want to help them make changes in their life. In a therapeutic relation, what are the ingredients? And the meta-analysis, what they reveal is that 40% of the changes that we can do in someone else starts from our own wellness. 40% of the changes of client is due just to the helping relationship there. And from the helper's side is wellness. So I think it's really important, to remind ourselves that wellness of the worker, well-being of the worker is really important. Despite this, when we're trained to be child protection workers, to work in the field, we're just trained to help others, to think about others, to care about others. Now I think in 2022, we need to train next future workers, child protection workers, to be aware of themselves in this job, because this job has a lot of emotional toll on their side. So that's what I want to add.
I really appreciate what you've said, Steve, and I like that we're bringing it back to also the research that we have that's been developing, especially out of the field of trauma-informed care. And one of the things that I've been incredibly struck with was a recent study that I did looking at residential child welfare workers across the province of Quebec and what their best sources of support were to deal with the challenges in their job. And the most surprising and unsurprising finding was that it was the support of colleagues. And it reminded me of when I was working and how important it was that I had people around me that supported me, that believed in me, that could help me, that could work me through the challenges. And so that idea of a web of support, of having a community of support that's not about a hierarchy and having a boss and a supervisor and all of those things, but that's about people together combining our strengths and working toward the same goals and being healing agents for each other as well as the people that we're working for. And so for me, I think that, we really need to shift the way we understand helping professions and to get away from this client and professional and power dynamic kind of situation and understand that we are all people in this together. We are all facing the same challenges together, and it's difficult for all of us in the same ways.
Sharp, I think that you're on mute. The joy of Zoom.
I think that's brilliant. I'm part of the Indigenous community in Ottawa. My ancestry is Sac, Fox, and Cherokee, and that really resonates. I haven't worked directly in child welfare, but I have worked serving the community. And from an Indigenous perspective, that's how we talk about our work. It's how we serve community. It's how we care for one another so that we're all well, so that we all have what we need. And my most profound example is exactly what you just said, Denise. I worked with an Indigenous HIV/AIDS agency where our jobs were more than jobs. Our jobs were a way of life. And we supported one another, and we understood the toll of doing that work. Because when you work in HIV, lots of your clients die, especially in the bad old days. And supporting one another through that and having the space to do that in the work and people who understood what it meant to do that work. But even more importantly, to work for an agency that gave space for that support. That was huge. And it taught me how important it was, because that analogy that I used at the beginning of those tools as a carpenter, I got from my mentor, from my boss when I worked from that agency. She walked the talk. She didn't just say self-care is important and you need to do it. To your point, Denise, about hierarchies of care and who gets to decide what care and what's not, and what's self-care and what's not. We were all in it together. And so we would heal together as much as we worked together. And no one person was responsible, and we could take those turns in leaning on one another wherever we had the capacity. And that's what we need, that breaking down that hierarchy between ourselves and particularly between the people we serve. Because it's so evident. It's so evident, and that in and of itself causes so much harm. And the people you serve as child welfare workers are intrinsically aware of that difference. And in many cases, when they're not, the workers remind them. And that comes out of a lack of balance, out of unwellness, out of stress, out of not having the space and the time to be able to do good self-care, to not feel like you're frazzled and at the end of your rope because you have so many cases. Or because your heart is breaking and nobody wants to acknowledge that their heart is breaking, because that's not professional. And I call bullshit on that. I really do.
I just had a quick questions for everyone now. Maybe you can answer in the chat box just before we're going to the next question. Do you know what is the proportion of child protection workers who are dealing with PTSD symptoms, depression, or anxiety? You have an idea what is the proportion, the percentage, though? I'm just looking at the chat box. So what do you say?
Oh, 100%, someone said.
100%, 40%. Well, a recent study just showed that it's between 35% to 50% that would have enough symptoms to have a diagnosis. Okay, so I think it's 100%. Yeah, 30% diagnosed, but 100% are dealing with. Sometimes they have more symptoms, sometimes they have less. And then if I ask you the second question, how many workers will downplay their symptoms? Will not talk about it to others? Will be shy, or will not want to talk about it with their supervisor, with their managers, because they fear that if they do so, they will be seen as unfit for the job, stigmatized as being weak, not good enough. So this is a high percentage, and this is part of a problem, because one of my study with child protection workers in Quebec and province of Quebec shows that if you work in an organization that you fear to talk about your symptoms of PTSD or vicarious trauma, of depression, to your colleagues or to your boss, you can have like four more, how would you say, not twice, thrice, but four more times the symptoms. So you have a lot more symptoms if you cannot talk to others about it. Like Denise said, what can be really protective about your well-being if you're a child protection worker is the support of your colleagues and the support of your immediate boss.
So I think, Steve, that leads in quite nicely to our second question, which is, how is self-care or worker well-being supported or not at the individual, management, and agency level?
I'm going to jump in here because I have a bone to pick with self-care as a concept.
One moment, Denise. There's feedback from your mic. And I saw that in the chat as well. So maybe we'll get you some tech support in the background and let someone else start the question. Okay.
Jamie, someone asked you to repeat the question if possible.
Oh, yes, certainly. Sorry about that. So how is self-care or worker well-being supported or not at the individual, management, and agency level?
Well, if you, it's okay, Sharp, if I go ahead with this one? Okay. I just look at what Deborah Jones wrote in the chat box. I guess you have, the first thing is that a lot of child protection workers are unaware of their own symptoms. Like I said earlier, I say we because I've been a child protection workers in Montreal for 12 years. And it's true that at this moment, I was so focused on helping others, recognizing symptoms in others, helping child parents dealing with their trauma. But I was not aware that all these symptoms could also reflect in my life. So my only aim was to help others, and I didn't have any methods, any ways of, assessing my own self. So that's what with my project in Quebec, we're trying to say that, well, if you want to take care of yourself first at the individual level, you have to take a time, maybe weekly, monthly, to say, well, what have I experienced at that job? How do I feel this week? What are my needs? So I think it's the first step to do. But then if we ask the question, what about the organization? What are they doing to help you guys? Well, I cannot talk about what's happening in Canada, but in Quebec, there's not a lot. We're just starting to be aware, and we're just starting to acknowledge that doing this job can have an impact on your psychological health. And even more than that, I would have to say that if you want to go on sick leaves there and you want to have some compensation from for work, well, you have to prove that what you have been experiencing in your job is extraordinary. So if I'm a child protection worker and a child bite me, is it extraordinary? No. If I'm dealing with stories of neglect, of abuse, and intergenerational abuse and so on, is it extraordinary? No, it goes with the job. So even at that point, it's not recognized by the government and all the organizations. So we really need to take actions, to change these things and to say, well, you do a job, you're exposed to a lot of traumatic events. It's normal that at some point you will also have some trauma impact in your life. It's not that you're weak. You're a human being. If you're not affected by that, I think you should go flip burgers at McDonald's. So that's what I had said first.
Tell us what you really think, Steve. Is it okay now? Are you still getting feedback? Okay, super. I wanted to jump in right away on self-care because I have a real bone to pick with it, and it bothers me because as a professional, it was the strategy that was always suggested to me and my colleagues during my education and as well as a professional. And the research is very clear. Self-care is not effective against PTSD. And many of the strategies that we suggest to professionals, I mean, put up your hand if you've been told to go to yoga as a human service worker. I love yoga, don't get me wrong, but there are limitations to the kinds of support that we can achieve and the kind of healing that we can achieve alone, because we are social animals. And so when we look at the kinds of toxic environments we are exposed to in a routine manner, we have to have proportionate responses to those toxins so that they can be managed for people effectively. And so I just want to, make it very clear that there's a nice body of research that tells us also that the most effective kinds of responses to traumatization are organizational. And when the organization puts things in place to protect the workforce, it's effective. And so when individual workers are told to do self-care, of course we have to do self-care. It's a part of our well-being, and it has its place and it's important, and I'm all for it. But we have to shift the conversation from that as being the focus and widen the conversation to be about collective care, because it's the most powerful agent of protection that we have.
Sharp.
To become again.
No, now you're not. You're good.
I'm off. Somebody else needs to control my mute. I agree with Denise about this whole notion of self-care and it being the individual's responsibility. I just finished a program at St. Paul University to become a registered psychotherapist, and they talked about self-care, and they talked around self-care, and they talked about mindfulness and meditation and all of these things. And it's the same thing when you're working in an organization. Like you said, go to yoga, be mindful, take a bubble bath. Really? We need more spaces where we can come together and heal together. When I was working for the HIV agency, we would bring an elder to Ottawa every 3 months or so. And we do a week of ceremony. We do 2 sweats. And the first sweat was for the people we served. And the second sweat was for workers who served the people. Got a lot of turnout because there aren't a lot of opportunities for people who are serving the people to come together to ensure as much as possible that the people they're caring for aren't physically present in that same location to be able to do that work. And sometimes research is a really powerful mechanism to help people to get what they need. I'm working on a community-based research project right now, which is examining how to reduce stigma and to make healthcare more culturally safe for primarily Indigenous people, but many, many people. And what we do is we're bringing workers out onto the land and we're doing ceremony. COVID's put a bit of a cramp in that. And most of these workers are not Indigenous, but they're sitting in circle with Indigenous people and they're learning from one another. And what they're learning is how high right now the grief and the loss and the stress is. Because we go into these kinds of work because we care, because our heart drives us to do it. And then we get told to be professional, we need to take our heart and leave it at home. And take care of it at home. Don't bring too much of it to work. like Steve said. We can't talk about those things. We can't address them. We can't even acknowledge that they're there. Has anybody noticed that that's in contradiction to all of the stuff that they teach us about how to care for the people, that folks need to sit with their feelings and acknowledge their feelings and work through their feelings, and professionals aren't supposed to do that? I've done presentations for most of my adult life, and I talk about the history of Indigenous people, and I talk about anti-oppression, and a lot of the work that I do gets feelings going. And you want to know which audience gets the angriest at me the most? A room full of professionals, because they've been taught and we've been hardwired to believe that emotions don't have a place in being professional. But in this work, it does. If you don't bring your humanity to this, I guarantee you're going to cause harm. If you don't have a mechanism to heal your humanity, because this work is hard, serving people in pain is hard. Serving people who are afraid of you, who are angry at you, who see you as the enemy is hard. And when you have no support for that, how are you supposed to have balance? And nobody's wrong in that picture, because those feelings are valid. But there are no mechanisms right now except go do some self-care, right? Go to the spa for a day. You'll be fine. No. We need change. We need systemic change. We need institutional change. We need to take the whole idea of what it means to be a professional, particularly in this kind of work, and turn it completely upside down and inside out. That's my soapbox. I better get off it before I start foaming at the mouth.
Steve or Denise, do you have a response to that?
I do have one, but I can also wait at the end that we're going to the third question if you want.
Sure. So I'll lead in, because all three of you have presented some ideas. And I know, Denise, I wrote down when you said that when organizations put something into place, it's effective. So I think that even as I'm kind of keeping my eye on the Q&A box, there are lots of people that want to know some particulars about what organizations can do and in supporting this. So we'll get into the third question, which is, do you have any guidance, either for workers individually or for the agencies that they work with, on this topic, just in general? I'm just going to open it up.
Want to start, Denise, or?
I'd love to hear you start, Steve, because you're implementing some really interesting work.
Your audio again, Denise.
Is it on?
It's on, but it's a lot of feedback.
I have headphones on. Now?
Okay.
Yes, better.
Okay, I was actually just saying I would love to hear from Steve, because
Okay.
he's been doing some really interesting implementation.
And then I just so I do agree with you guys what you said earlier. Sorry, you hear my dog there? Sorry. It's true that, only self-care, and I will say, okay, just accept what I'm saying now, like new age stuff of self-care doesn't work. If it's only doing that, well, you should just do not try to start meditate or try to do mindfulness. You just grab a glass of wine and listen to Netflix. It will do the job. Okay? But there's some self-care that, that are anchored in cognitive and behavioral approaches that can help. Like, trying to see what stress you at job, what are your stressors, and using some methods, to be in problem-solving approach. That could be considered as self-help. But if you do it alone and you're in an organization that are not aware, do not acknowledge what you're doing on, I do agree that it's ineffective. But if you have a collective support, and then after your colleagues or your boss just teach you how, well, tonight you should try this at home, that would enhance all the collective support that everyone's providing to each other. So what can organizations do about that? I think an organizations that really want to help the well-being of their employees should start by having a plan. A plan that have some actions before. A child protection workers develop psychological distress, with training about what are the reactions of vicarious trauma. When should you go seek for help? What can you do as a group to prevent the emergence of these symptoms? And then after, organizations should have a plan that if a really huge traumatic event happens to one of your workers, what should we do as an organization in the 31st days after this event? And then, if after 30 days your worker is still really coping badly with the situation, then you need to have some counselors, therapists that are trained in trauma approaches, or have experience of child protection as their own, because they will understand what your worker is going through. I think organizations should first have a plan, that can lead actions before your workers are being traumatized, 30 days after, and in the long run. So workers need to be aware and have the right to talk about it, and they have to be aware if they want to seek the help of their colleagues or their boss. So I think in an organizational procedure, you have to give yourself an action plan.
Can you hear me, and is there feedback? Okay, super. I completely agree with everything that Steve has just said, and I think that when you listen to his description, you can hear how it's embedded within an agreement that's organizational in nature, that everybody's on the same page and there's a coherence, that from management all the way down to the front lines, everyone understands this work is challenging, everyone understands, as Steve said before, it's normal to feel traumatized by traumatic exposure. And I wanted to also add that the research around is it the worker or is it the work is pretty definitive. It is not individual factors. It's not the worker who's weak that causes this work to impact us. They've looked at all different kinds of factors, such as having a history of trauma, such as having this much training or that much training. And while there is, outcomes are much better for people with more training and so on, actually becoming traumatized isn't your fault. It's because you haven't had the support that was necessary to manage the load that you were carrying. And I think that decision, being trauma-informed and understanding that at the organizational level, and then putting the steps in place as Steve described, and also as Sharp described in some of the work that they've been doing, these are the things that help us to stay well and help us to heal when we become hurt.
I totally agree with all of that. I think what's needed is a social justice decolonial approach to everything. We can't change the system writ large, but we can make changes to smaller pieces of the system. And we do need that commitment. We need that commitment from the head of the agency down to the next worker. A number of years ago, I was working with Indigenous agencies to try and help Indigenous agency or child welfare work better with Indigenous populations. So the management got the message, but they didn't pass it down to the workers. So sometimes there's a lack of communication. The other thing that we need to do, that organizations need to do, is to destigmatize what happens to people when they're doing this work. Because that stigma is killing people. And it doesn't matter where you go or what kind of stigma you're talking about. Stigma kills people. It kills people because it prevents them from reaching out when they need help. And then when you have a system that doesn't have anything for them to reach out to, But that stigma, the stigma that allows us to sit in that notion of professionalism, in that notion of weakness, that stigma that silences us, that, well, I'm just making a big deal out of nothing. It's not that bad. It's not that bad. I can't take a break. I have so many clients. The stigma that prevents us from being able to ask for help. And then writ large, we've got a system that continuously cuts us back, right? And that's where the social justice piece comes in, because, you know, we have this messed up system where we're paying politicians 6-figure salaries and teachers and social workers next to nothing. Budgets for hospitals and child welfare agencies and all kinds of other social welfare agencies get continuously cut while politicians vote themselves wage increases. We've been in a pandemic for 2 years, and the amount of support that agencies that are trying to support people who were already marginalized to begin with is non-existent. Here, just throw some PPE at it. These are people's lives. We need to fundamentally change our system, and the only way we can do it is through social justice, decolonial, anti-stigmatizing procedures, policies, ways of walking in the world. Because what we've got right now isn't sustainable for anybody, and it's not healthy for anybody. It's killing people. How are we going to make it stop? Turn things upside down. That's what we need to do. I'm feeling a little bit radical today. It might be because of all of the snow that I've had to shovel.
So if I can take that one step further, if I was a human resource manager at a child welfare agency, and I'm sure there's a few that are on this webinar today, what is one small thing that can be done, or one big thing, tomorrow to start an implementation plan for wellness for staff that would actually make meaningful change?
One thing that I would suggest would be that every person working in an agency is aware of the procedures if they become impacted by their work, and that they understand from where to get immediate support up until where to receive a medical leave of absence, that they understand what is available to them in terms of their resources, and that they can access those without judgment or stigma. One of the things I wanted to just pop in on was there was a comment saying that trauma-informed care and trauma-informed yoga and these things can be very helpful for people. And I just want to really support that statement. I think that there's the issue that I'm seeing, having been involved in implementing trauma-informed care for the past 4 years, is that we see that it works really well on the ground, but the disconnect is that it doesn't have the support from the upper levels. And so now I'm really interested in advocating for that support to really start getting installed at those upper levels, because we do see the success when we do it in practice, but we also see the limits because staff do not have access to the breaks that they need. Their staff meetings get cut whenever there's a short staffing list. So it's the first thing to go. And we see that over and over again in practice, it's the staff that will lose the things that they need in order to provide the services that the clients need, which of course is extremely important, especially in essential services. But I'm trying to argue, and I think all of us here today are trying to argue, we've got to get a little more proactive and plan a little better so that we have things that can buffer and cushion when there's not enough staff, so that we don't lose the staff meetings. We don't lose that time for informal support. We don't lose the ability, as Steve has brought up, to have those meetings and bring someone in after 30 days and have the resources to do all of that. That really does have to come from above.
I agree. One small thing, provide opportunities for people to come together and talk about the real shit. No stigma, no judgment, Not a staff meeting where you've got an agenda. Bring in somebody from outside to facilitate the discussion so that there's safety. And we need to push back. We need to push back to funders. We need to push back. What's it going to look like? I don't know, but it depends on your capacity. But I think a starting point is that destigmatizing, having those conversations, providing opportunities for people to come together and be real about their grief and their loss and their shame and their trauma and all of those other things. I'm not talking about group therapy, although in a way it is. Not a staff meeting, an opportunity for people to come together as human beings and share their humanity and understand that they're not actually completely alone in all of this. An opportunity, shared experience is a huge thing. I'm sure any of you who have worked with clients and you've used that safe and effective use of self to disclose a shared experience. You know, if you're working with addicts and you happen to have been an addict or be an addict, it gets your foot in the door a little better. It sets up a common ground. And we need to do that destigmatizing work. We need to have those conversations and talk about those things that are difficult to talk about and challenge the idea about what it is, what it means to be professional. What does it mean to be professional in this agency? Somebody else might look at me and say, I'm not being professional. I'm being a human being. And in this work, that's what's most important. And we're all going to be human beings together and have those opportunities. And sometimes, remarkably, it's been my observation, sometimes just having a space where you can get those words and those feelings that are percolating in and around your head and your heart, and you can just get them out. And you hear them with your ears instead of with your brain. And somebody else says, hey, it resonates with me. I'm having a similar experience. Sometimes that's just enough. And it gives you enough balance that then you have the capacity to find those other tools and to access them. We need more conversations.
Thank you. Steve?
Yeah, well, I think take-home message today is that we have to try to find some ways in our organizations across the country to find way to destigmatize vicarious trauma of the workers. And one thing, if you are a human resources agent, well, I think you have to train your managers to, to be able to welcome the emotions experienced by your workers. I've been doing a study in Montreal, and we have been giving some instructions to managers. On one group, we said, if one of your workers experienced some trouble, try to find any ways practical to help him. Look at his cases, at his workload, provide him with support, with everything, but do not talk about his emotion or his difficulties. Then we asked the other group, do nothing, but just said, well, I acknowledge what you're feeling now. I know I've been a worker too, and I know we feel like shit sometimes, and we're angry, and we're sad. Guess what? After 1 year, which workers were the best adapt to cope with the situation? It's the one that the supervisor just acknowledged what they're experiencing. The worker didn't do anything else than take time to welcome the emotions, give right to the workers to experience these emotions. So this is one first step. And I think I do agree with, people talking about what they're feeling, but I do have some concerns. In the workplace, it has been shown that for some people, just emotional debriefing could worsen their case. Because you can go on and if it is not done properly, well, these meetings can just fuel on bad emotions and resentment against the organizations. So I guess we have to give them spaces to express themselves and respect if some people don't want to talk about your emotions, because it's not everybody that want to talk about your emotions to their coworkers. But when they talk about your emotion, then after, as an organization, it's to say, okay, you feel that now, you have this emotion. What is the function of this emotion? What are your needs? How can we help you to feel better? I guess we have to, first, we acknowledge, we experience it, we accept it, but then after we have to think, well, how can we improve things? I know that for some people, just telling about their emotions, putting out there, but it's okay. But for some, then after we need actions. We need to find some control in the situation, some self-efficacy in dealing with these emotions. So I guess that's what I'm doing in some organization. I'm implementing psychological first aid, peer support, and manager support programs. So the manager and peer support will work together to help someone. First, they will hear what is he experiencing, their emotions, but then after they'll say, okay, so we acknowledge you have the rights for these emotions, but how can we help you to deal with the situation now, but to teach you how to deal with the situation for your career, because you're going to experience it more and more, because you're going to have complex cases, you're going to have more children, more parents. And for vicarious trauma, we know that the more you're exposed to, the more you're prone to develop PTSD symptoms. So I think it's okay, and it's really good to talk about what we're feeling, but then after we have to help them find some ways to cope with the situation efficiently. That's what I had to say.
Thank you. Denise, last comments before we go to some questions?
I think the last thing I'd like to add is just that there is a network in Canada of clinician researchers who are doing applied research in this area. Steve is one of them. Delphine Colin-Vézina McGill is one of them. Lise Milne in Saskatchewan is one of them. In Quebec City, I am one of them. There are a network of us. And so I would like to invite people in human resources departments and in management positions and policymakers to reach out to us, because we are hungry to create partnerships so that we can implement changes that are based in evidence and efficient. And so take advantage of us being here. We're ready and excited to work with you.
Thank you, Denise. Okay, we have about 10 minutes left, so I'm going to go over to the questions that were posed in our chat. I won't get to them all, so I'm sorry in advance. So we have a question here, because there was some conversation about peer-to-peer support. So a question from a worker saying, how do you support a peer while you're also taking care of yourself? When you're dealing with your own trauma within your caseload, but you want to be there to support your peers?
I can start, since I'm implementing those approaches. Well, the first thing is that, Caitlin, first you have to recognize, do I have enough energy? Do I feeling enough well to start helping another one? So that's the first question you have to ask yourself. But then after researchers, have summed up, there's 5 things you may do to help a colleague. First, you have to help him find a sense of safety at work. Then after, you have to help him find some ways, to take some time to calm down, to simmer down if he's really stressed. So that may just talking with him, go for a walk with him. After, that would resonate with what we are saying since the beginning. You have to say to him, you have to be connected to your coworkers, to your peers, to your loved ones. Don't isolate yourself. It's really important that you're not alone in this one. And by connecting to others, it's not just talking about emotion, it's just doing stuff with others. Then after, you have to help him find some way to perceive that he is efficient in the situation, even though the situation is worse. So you have to work on this sense of self-efficacy. And we can also talk about team efficacy. And then after, if you do this 4 things, then you will say, well, okay, now I understand that I'm in a bad mood, I'm in a bad moment. But there's hope. There's hope. There's ways that together we can go on with this situation. So there's 5 ways that, when we look at all the programs that have been implemented in peer support, well, we sum up with those 5 things: sense of safety, calmness, connection to others, self-efficacy, and a way to always, nourish the hope that we can do it together. That could help people.
Thank you. Does anyone else want to weigh in on that, or I'll move to another question?
I could just say quickly that the components of mentalization-based therapy are really helpful in peer interactions. And so some of those things are helping people to make sense and put into perspective the challenge that they're facing, offering validation for what they're dealing with, and just simply saying what you're dealing with is difficult, and yes, this is a challenge, so that someone has a mirror that they are not alone in this. And non-judgmental interactions are extremely important. If we can't be supportive of people when we're intrinsically linked with judging them. And this is one of the reasons why supervision, which is disconnected from management, is often a very important choice to make in an organization. And finally, what I would say is just to underline everything Steve said, but really that piece about hope as being incredibly important. It's very easy to lose perspective of the incredible value of this work when it's so difficult and can be so dark, but you are changing lives. And I just want to remind us all of that, and that we are incredibly in your debt. We appreciate what you're doing. We thank you for what you're doing every day.
Thank you, Denise. I think that we'll go to one final question before we wrap up. So we have a viewer who says that they are actually a retired social worker after 35 years in the field. And she's been hearing about research and proposal of changes for many, many years, and is just wondering if there are any examples of work environments who are doing it right. Are there any agencies that have actually implemented research and are doing this right that we can model after?
I don't know specifically about child welfare agencies that are doing this right. I know of some other agencies, some Indigenous agencies and some non-Indigenous agencies who do kind of broader scope social services, social care for folks. And they're agencies that have done kind of what I've talked about before, where they provided opportunities for people to come together. And that's the interesting thing, right? Is when we think about supporting someone, whether it's as a peer or as a professional, just like the idea of what it means to be professional, we have an idea about what support needs to look like. What if support doesn't have to look like anything? What if support is being able to create spaces where people can feel that most important thing, which is some sense of safety, that they can actually be who they are? And that's hard work to be able to create spaces like that. And it will happen slowly by destigmatizing and decolonizing.
Just want to add it, so to give you hope. When research finds something, we know that it takes about 17 years before we see the results in real life. Okay, so I could say that in Montreal now, I think they're doing right. They're giving themselves all the programs for workers and also for children, to be trauma-informed care and to have good practices. But I must tell you that what led to this is that 2 years ago, 2 child protection workers from Montreal committed suicide. So that's what led them to say, okay, now we have to do the right things and, ask researchers and scientists what could be done. But prior to that, I was telling them, you have to do this, don't wait. And they say, yeah, you're a nice guy. We like your conference sometimes. But when I would ask them, well, are you ready, to invest money and time and resources to implement these things? They will all say, oh, we have so many other things to do. Then 2 of their workers committed suicide and they said, okay, now we have to do something. So, as a child protection worker, I think we're always in urgent situation. There's also always a feeling of urgency. So we're more in a way of, we're trying to respond to crisis instead of preventing stuff. So I guess that it's more like discussions like this that we can sensitize organizations that you have to prevent those things, and we can prevent those things. So that could be my last word for today.
Thank you. And Denise, a few words to wrap up?
Sure. I think if people are interested in finding models to guide them, then if you're looking at trauma-informed child welfare approaches, there's an excellent book by Strand and Sprang. There's the Blaustein and Kinneberg ARC model. There are multiple different approaches, some of which are being implemented right now in Canada and in Quebec specifically. And I guess what I will say is a word of just the profound changes I saw, because I conducted interviews with 100 workers, and then a year after they had been doing a trauma-informed model implementation, I conducted those same interviews. And I can tell you that when I left that first round of interviewing, I had a pit in my stomach and my heart felt very heavy. And a year later, after they had tried this new way of working, I felt light and hopeful and excited. And so there's a lot of really great stuff going on and a lot of change that really is happening. It's just, as you know, these are services that happen in secret and we don't always get to see it. So I just want to let you know that, like Steve, what he's seeing in Montreal, I've been seeing this all over the province of Quebec where these programs are being implemented, and it's really exciting.
Perfect. Thank you all so much, Sharp, Denise, and Steve, for a wonderful and lively discussion on a topic that's really hugely important in the child welfare sector. I invite all of our attendees to follow the Child Welfare League of Canada on social media in order to hear about upcoming events in this series. And again, this webinar will be available on demand in up to 4 hours using the same link that you used today for the live presentation. And your certificate of attendance will be emailed to you up to an hour after the presentation concludes. Thank you again, everyone, for choosing to spend this hour with us today. And I look forward to having many of you join us at our future events. Have a great afternoon.